What if your body has been warning you for months, even years, but you didn't notice? What if the signs were quiet, subtle, and easy to ignore, until suddenly it's too late? Today, we're talking about 5 early cancer signs most people dismiss, not to scare you, but to empower you. Because early detection saves lives, and your body always speaks before it breaks. Let's start with something many people brush off: unexplained weight loss. Losing weight without trying might sound like a dream, but medically, it can be a red flag. When cancer cells grow, they steal energy from the body and change how your metabolism works. You may notice your clothes getting looser, your appetite dropping, or feeling full faster than usual, even though your routine hasn't changed. Studies show that unexplained weight loss can be one of the earliest signs of cancers affecting the digestive system, lungs, pancreas, or blood. Next is constant fatigue that doesn't improve with rest. This ISNT, normal tiredness after a long day. This is deep exhaustion that sleep doesn't fix. Cancer can cause inflammation, hormonal changes, and reduced oxygen delivery to tissues, leaving you feeling drained even after doing very little. Many people report months of extreme tiredness before diagnosis, but they assume it's stress, age, or workload. Third is persistent pain with no clear cause. Pain is your body's alarm system. When pain sticks around in your back, abdomen, chest, or bones without injury or explanation, it deserves attention. Cancer can cause pressure on nerves, organs, or tissues long before it's detected on scans. Ignoring chronic pain delays diagnosis and treatment. Now, let's talk about unusual lumps or swelling. Most people think of breast lumps, but abnormal growths can appear anywhere: neck, armpits, groin, testicles, or under the skin. These may be painless and easy to ignore, but they often signal changes in lymph nodes or tissues that need medical evaluation. The earlier these are checked, the better the outcome. And finally, in this part, changes in bowel or bladder habits. Ongoing constipation, diarrhea, blood in stool or urine, pain during urination, or sudden urgency can signal cancers of the colon, bladder, prostate, or reproductive organs. These symptoms often start mildly and gradually worsen, which is why people delay getting checked. Here's the truth. Cancer doesn't usually begin with dramatic symptoms. It whispers before it screams. Your body gives small clues long before serious damage happens, but most people ignore them because they don't feel urgent. Now let us talk about signs that many people live with for months, even years, without realizing they could be serious. One of the most overlooked signs is a cough or hoarseness that doesn't go away. A lingering cough, chest discomfort, shortness of breath, or voice changes lasting more than 3 weeks should never be ignored. While infections and allergies are common causes, persistent symptoms can sometimes signal lung, throat, or thyroid cancers, especially if the cough worsens at night, produces blood, or is accompanied by weight loss or fatigue. It's time to get checked. Another subtle but powerful warning sign is difficulty swallowing or constant indigestion. Many people assume heartburn, bloating, or a feeling of food getting stuck is due to spicy food, stress, or acid reflux. But when these symptoms become persistent or worsen over time, they can indicate cancers of the esophagus, stomach, or throat. The body is incredibly good at adapting, which means problems can grow quietly while symptoms stay mild at first. Next is unusual bleeding or discharge. This includes blood in stool, urine, cough mucus, vaginal bleeding between periods or after menopause, or unexplained bruising. Bleeding is never something the body does randomly. It always has a cause, and when the cause isn't obvious, it must be investigated. Early detection in these cases often leads to very high survival rates. Another commonly ignored sign is changes in skin, especially moles or wounds that don't heal. A mole that changes size, shape, color, or starts bleeding deserves attention. Likewise, sores that don't heal after several weeks, especially in the mouth, skin, or genital area, may signal skin or oral cancers. Cancer cells interfere with normal healing processes, which is why these wounds linger. And finally, in this part, persistent fever, night sweats, or infections. While infections are common, recurring fevers or excessive night sweating without clear cause can indicate cancers affecting the immune or blood system. Many people dismiss these symptoms as flu, stress, or weather changes, but the body doesn't produce fever randomly. Here's the deeper truth. Cancer doesn't start suddenly. It develops slowly, quietly, and during this time, your body sends early signals. The tragedy isn't cancer itself, it's how often those signals are ignored. Now, here's the most important part. What you should actually do if you notice any of these signs. First, don't panic, but also don't ignore your body. Most of these symptoms don't automatically mean cancer, but they do mean something needs attention. Early testing doesn't create problems, it prevents them. In fact, when cancer is detected early, survival rates increase dramatically because treatment is simpler, faster, and more effective. Second, track your symptoms. If something lasts longer than 2 to 3 weeks, worsens, or keeps returning, write it down. Note what you feel when it happens and whether it's changing. This information helps doctors make faster and more accurate decisions. Third, prioritize regular screenings. Many cancers, including breast, cervical, colorectal, prostate, and skin cancers, can be detected early before symptoms even begin. Screening doesn't just save lives, it saves families from loss, stress, and suffering. Now, let's talk about prevention, because while not all cancers are preventable, many risks are controllable. A diet rich in whole foods, fiber, fruits, vegetables, and antioxidants supports immune defense and reduces inflammation. Regular movement improves circulation, hormone balance, and detox pathways. Quality sleep repairs DNA damage and strengthens immunity. Avoiding smoking, excess alcohol, processed foods, and environmental toxins dramatically lowers cancer risk. But perhaps the most powerful protection is awareness. People who listen to their bodies and act early live longer, healthier lives. Cancer doesn't usually announce itself loudly. It speaks softly first, and those who hear early survive longer. The truth: your body isn't fragile, it's intelligent. It warns you when something is wrong. Your job isn't to fear symptoms, it's to respect them. Early detection doesn't just save lives, it saves futures. Your life is worth paying attention to. Your health is worth listening to. And your body right now is speaking to you in ways both loud and quiet. Most people don't lose their lives to cancer because treatment doesn't exist. They lose it because warning signs were ignored. But you are different. Awareness gives you power. Action gives you time. And time gives you life. If something feels off, trust that feeling. Get checked. Ask questions. Push for answers. Because early detection doesn't just change outcomes, it saves families, dreams, futures, and moments that haven't happened yet. Your body is not your enemy, it's your protector. And when you listen early, you live longer. Stay aware, stay proactive, stay alive.